but that's what it's for. It's to make that more accessible healthcare for individuals. You see here at the bottom, income subsidy plan selection. So you run the application, you run the eligibility, the qualifications, you see what they're eligible for, and you help your clients pick a plan. What do ACA plans cover? ACA plans cover all all 10 essential health benefits. And then all health plans on the marketplace cover a set of preventative services at no cost to the client. Things that are covered, though, the essential health benefits would be things such as outpatient care, maternity, newborn care, emergency services, lab services, preventative care, prescriptions, rehab services, hospitalization, mental health, and pediatric services. That is a list of everything covered as an essential benefit, but there are other benefits, obviously, plan by plan. Who qualifies? Who qualifies for ACA would be those who reside and live in the United States. They are a U.S. citizen or national, or they are a lawfully present non-citizen in the United States. They cannot be incarcerated. They have to file their taxes. At least to qualify for subsidies, they have to file their taxes. And with that being said, if they are married, they are required to file jointly with a spouse. Lots of tax compliance that we can go into on another day. For those of you not familiar, we do webinars every other week on compliance. Love to have you on those. With that being said, they must not have coverage elsewhere. No employer coverage as long as it's considered affordable. No Medicaid, Medicare, TRICARE, VA, you name it. They can't have other coverage, in other areas. The great thing is if they lose coverage or they don't have coverage, this would be their best bet here. Enrollment periods. So for this year, 2026, the open enrollment was November 1st through December 15th for a January 1st effective date, and then December 16th through January 15th for a February 1st effective date. That is no longer going to be the window. We are reverting back to the original enrollment period. It will be November 1st through December 15th for January 1st coverage. That is it. That is open enrollment. If anyone enrolls after December 15th, they have to have a special enrollment period. Without a special enrollment period, they are not eligible to enroll in coverage. What would that look like? Special enrollment periods? These are triggered by certain qualifying life events. Few examples, not all, but loss of qualifying coverage, marriage, birth of a child, moving to a new county with having pre-existing coverage the last 60 days, losing Medicaid, etc. You name it. There are a list of qualifying life events on healthcare.gov if you do want to look up and get more familiarized with those. The beautiful thing is with special enrollment periods is you as an agent broker, you can enroll people year round. Things are a little different outside of open enrollment. You have to find people who do have qualifying life events, but the point stands, you do have 12 months of year-round work that you can enroll clientele. Now, why do we need great ACA agents? Millions of individuals still don't understand how ACA works or what they qualify for. Millions. Knowledgeable caring agents bridge the gap. If you've been on any of my other webinars, I utilize that terminology a lot. We need agents to bridge the gap between the marketplace. We need good agents to bridge the gap between the insurance carrier and the client. What that means is guiding clients to affordable, life-changing coverage, but not only that, helping them with documentation, paperwork, premiums. Your goal is to assist clients to your best that you can. Many go without coverage simply because no one explained their options. It's crazy the amount of people I'll talk to in open enrollment and I'll ask, hey, so what are you currently doing for coverage? They say, oh, I don't have anything. I'm like, what do you mean you don't have anything? They're like, well, I just don't understand it. I don't know how to get it. I don't understand where to get coverage, how it works. I've created some very strong lifelong clients just by explaining things clearly and simply. By doing so, this can create a meaningful career with long-term stability. The word I want to focus on there is meaningful. A lot of time, what we see here in the industry, and I'm speaking from an industry standpoint, we see a lot of agents want to come in here and just get as many enrollments as they can, um, enroll people, call it the shotgun approach, throw everything at the wall and see what sticks. That's not very meaningful in my eyes. Sure, creating generating some income, that's great. But when you're not retaining clients, you're not serving clients, you're not helping clients on a day-to-day basis, it's not meaningful. At least for me, I don't feel fulfilled when I'm not actually helping people. When I take time and effort to serve my clients with all my heart and help them day to day, I create not only a meaningful career, but I've created meaningful relationships, which has led to so many other opportunities. I have done group insurance because of some of my individual relationships. I've done life insurance. I've helped people out, friends, family. I've created some really strong relationships. Some people that I'll get together for lunch. That's how strong these relationships have grown. So be a great ACA agent. Great ACA agents are compliant and they care for their client far beyond just enrolling them in a plan. They prioritize the consumer needs, not the broker needs.